Good afternoon. Mark Koval. I'm the CEO of National Association for Behavioral Healthcare, and I want to welcome everyone to the 2019 annual meeting of NABH. We're very excited about this year's meeting. We believe we have a great program, and we just very happy to see everybody here, new and old friends. I want to first thank Barron's and Associates consulting firm for supporting this opening session. Ann Barron's, the CEO, was not able to attend this meeting today, but she sends her best, and we want to thank her for this, for the program sponsorship. Also, I want to thank the 2019 Program Committee. The Program Committee Chair, Frank Ganassi. Frank is President and CEO of Rutgers Healthcare University Behavioral Healthcare. Also, Jeff Hillis, CEO of AdCare Hospital, and Dr. Hirsch Trivedi, President and CEO of Shepherd Pratt Health System. Now, let's give him a round of applause. I'm going to now introduce our board chair, Pat Hammer.
Good afternoon, everyone. On behalf of the NABH Board of Directors, I would like to welcome and thank everyone for attending our annual meeting. It's an honor to represent NABH as the association's board chair for 2019. I am really proud of the work that we are doing as an association to help remove barriers so that patients and their families gain access to life-changing mental health and addiction treatment services. I'm extremely optimistic about the future of the behavioral health industry, and I believe the very best years in behavioral health are in front of us. I'm pleased to announce that NABH is launching a bold new initiative starting today called Access to Care. The Access to Care initiative was created to address two major issues that serve as barriers to our patient care delivery systems. Major issue number one, denied claims. Major issue number two, excessive regulations. Denied claims and excessive regulations often prevent us from offering the right care in the right place at the right time. In an effort to take action and make changes with third-party payers and regulatory agencies, NABH has created a managed care committee and an interim regulatory task force to address these challenges. I'm excited for all of you to see the results of our work this week, starting with the Access to Care resolution that was placed on your chair in the grand ballroom as you entered the room today. The board reviewed this resolution earlier this month and adopted it earlier today at our board meeting. I encourage you to read this document carefully and please partner with us as we launch this bold initiative designed to help break down the barriers that prevent our patients from having access to care. The Access to Care resolution also provides guiding principles that we as an association recommend providers and payers include in their contracts. There are other ways that we will promote our Access to Care initiatives this week, including a first-of-its-kind report that we will release tomorrow that highlights the regulatory burden facing inpatient psychiatric facilities. I look forward to sharing more with you on our year-long Access to Care strategic initiatives, but right now, I would like to introduce my fellow board member, Dr. Hirsch Trivedi, President and CEO of Shepherd Pratt Health System. On behalf of the board, I do want to thank Hirsch and the entire 2019 Program Committee for developing an outstanding program.
Thank you, Pat. Welcome, everyone. I just want to take this moment and we're going to see a video. And the video that we're going to see is from someone who is my state senator, but more importantly, he's been a wonderful advocate for mental health. And so our 2019 NABH Healthcare Champion is Senator Ben Cardin. We're all grateful to Senator Cardin for his behavioral health care advocacy. And with that, I want to introduce this wonderful video. Thank you.
Greetings to everyone gathered for the National Association for Behavioral Health Care annual meeting. I'm Senator Ben Cardin of Maryland. I'm pleased to welcome you to our nation's capital. I wish that I could be with you in person. Let me start by thanking you for what you do every day. You're on the front lines of these battles, the battles to eliminate the stigma of mental illness and addiction, and to save and repair lives caught in the web of the ongoing opioid epidemic. Rarely is there an issue that impacts nearly every single corner of our country. It is taking a toll on our families and communities as a whole. As you know, nearly 20% of Americans experience a mental illness or substance use disorder. Despite this prevalence, there are substantial barriers like cost and stigma that keep too many people from accessing the behavioral health treatment that they need. I can tell you that in Maryland, every local official I meet with, from the rural towns to big cities and everything in between, they all want to discuss how best to tackle the issue of opioid addiction. My answer? We must treat the opioid crisis like the public health crisis it is. Greater access to behavioral health treatment is needed now more than ever. We need collaboration at all levels. No one entity can do it alone. Lawmakers and leaders from both sides of the aisle also recognize this fight as a national priority and not a partisan one. It's why, with an overwhelming 99-1 vote in the Senate, we were able to secure billions of dollars in funding last year through the Opioid Crisis Response Act to address this crisis head-on, to increase treatment, prevention, and related research. More than ever, we need to continue building on patient-centered integrated care and comprehensive, urgent, and ongoing treatment that effectively helps to sustain lives and sustain recovery of individuals suffering from substance use disorders. Your theme for this conference is spot on: improving coordination, collaboration, and integration. I want to take a moment of Maryland pride to acknowledge Dr. Hirsch Trivedi, President and CEO of Shepherd Pratt Health Systems in Baltimore. Dr. Trivedi is a member of the 2019 NABH Annual Meeting Program Committee. Many of you may not be as familiar with Shepherd Pratt as I am. I can attest to you that Shepherd Pratt Health Systems is an incredible resource for Marylanders. They have been named one of the nation's top mental health programs for nearly 30 years. They help more than 70,000 Marylanders annually, and I am so proud of the work that they are doing for our region. Lastly, let me thank NABH and all those who keep the organization running 365 days a year. Your dedication to behavioral health care is a commitment to improving people's lives. You give people a second chance when they need it most. So it is an incredible honor for me to have been named an NABH Behavioral Health Care Champion in 2019. I will continue working in the Senate to ensure that Americans' mental health care services are the best and most accessible in the world. Please keep up your work changing people's lives. Thank you.
Yes, we want to thank Senator Cardin for his warm welcome and especially for his work as an NABH champion to help us advance our mission and vision. Another important piece of the Access to Care initiative is our effort to personalize what access to care really means. I think you will agree that the video we are about to watch will help us do just that. Let's roll with the video.
If we're all equal under the law, why do some laws require that I be treated differently?
And limit my rights to care and services afforded to millions of other Americans?
Why should I be denied access just because I'm different? Isn't that discrimination?
You may not be able to tell by looking at me, but I can tell you, I battle depression.
I live with schizophrenia.
Bipolar disorder affects my life every day.
I fight an opioid addiction.
I struggle with an eating disorder.
For me, it's anxiety, and for that, I'm discriminated against.
There's nothing easy about living with a mental illness or an addiction.
Some days, it's all I can do to get out of bed.
Feeling discriminated against makes it even worse.
My goal is recovery. It's my doctor's goal, too.
Behavioral health care is personal.
Trained clinicians and healthcare professionals understand my challenges.
They know what I need.
Which is why I need access to the care they provide.
You know, I think we can all agree that the message in this video is one that we need to promote to policymakers, regulators, patient advocates, and the media. One way you can help us is by tweeting and retweeting messages about the Access to Care initiative. We are live tweeting from this meeting at #NABH19.